Good morning, all my friends. So wonderful to see all of you here today. Welcome to the East Center and welcome to the second part of our Live Station series, our Caleb Live Station series. How many of you were blessed by Pastor Chua's sharing last week? So last week, Pastor Chua shared with us that the best season is in our seniors years. That we are in the best season to win souls for Christ. That our best season in life is actually in front of us and not behind us. So why don't you tell the person sitting next to you, your best season is in front of you. You know, as a church that has a lot of young people, sometimes older people like us, we can feel left out, we can feel a bit neglected. And I'm here to tell all of you that all of you are so precious to the church. All of you are so precious to the church. And as a church, we want to do our best to care for you, to journey together with you through your senior years so that we can all age gracefully and beautifully. How many of you want to age gracefully and beautifully? That's why last year we did a survey among 76 seniors across the different centers in the church to find out what are some of the key concerns, the top concerns of seniors. And the survey results shows us that the top concerns among the seniors in our church is, first of all, health. Number one is health. The slides, please. And the second concern is spiritual growth. And the third concern is the salvation of our loved ones. And this top concern of health is also the topmost concern of aging among the Singaporeans in this nation. So that's why today I've put together a panel of doctors who will be able to come and share with us and give us some advice, give us some tips on how we can live healthily so that we are able to age gracefully. Okay, so according to the data from World Health Organization, the healthy life expectancy is 10 years behind the average life expectancy in Singapore. That means there will be about 10 years of our life whereby we are unhealthy. Okay, so in order for us to live a purposeful life, it's so important for us to live as healthily as we can for as long as we can. Because once we are bedridden or once we are so-called dependent on others for our basic needs, it will be very difficult for us to live a purposeful life. So without further ado, let's put our hands together to welcome our panel of doctors. So I have here with us three doctors. So we have Dr. Chi Kiong. People, you may know him as Dr. CK.
My life group.
So he's a heart specialist. He will introduce himself a bit more later on. So we have Dr. Edward here.
Good morning.
Okay, Dr. Edward probably know me better than any of you here, okay? Other than my wife, because he has seen my bottom. When he did the scope for me earlier on this year. So Dr. Edward is going to talk to us about gut health. And then last but not least, we have Dr. David. So Dr. David is a psychiatrist, and he will be addressing mental health issues with us. Okay, so I think heart is a very important thing. So we want to start with our heart first. Let's get our hearts right. Yeah. So according to data in Singapore, ischemic heart disease is one of the top deaths in Singapore. So maybe Dr. Chi Kiong, you can start off by maybe give an introduction of yourself and share with us a bit more about this ischemic heart disease.
Okay, all right. How do I forward the slide? How do I forward it?
Down.
Press down. Oh, okay, all right. Where do I press? Okay, good. So I'm a heart doctor. And in Proverbs 4, verse 23, it says, above all else, guard your heart, for it is the wellspring of life. So heart is very important. So I'll talk about the physical heart, and I hope along the way we'll talk about the spiritual heart, okay? I want to share with you some common diseases. Number one, abnormal rhythm called atrial fibrillation. All right. Okay. Look, if you look at the animation, this is a normal heart beat. The upper chambers pump, the blood flows nicely down to the lower chambers of the heart, and then lower chambers eject the blood to the lungs and to the rest of the body. See, it's very coordinated. Upper chambers pump, the blood flows nicely down to the lower chambers, and it goes up to the out of the heart to the rest of the body. A marvelous design by God. You know, the heart pumps about 90,000 times a day. A little faster when you run, slower when you slow down and rest. You know, and I see some people are nodding in agreement. Like David Wu, he's like nodding in agreement, and the heart rate is very slow and relaxed right now. All right. So this is an amazing thing about the heart. Let me show you what is atrial fibrillation. The next. Okay. So both videos are playing. In atrial fibrillation, the upper chambers are not pumping on a regular basis. You could see on the right side, the right RA or right upper chamber. It shows the upper chambers is quivering, as though it's like a cramp, you know, shivering. And as a result, the blood flow, you could see there's no good and effective blood flow out of the heart, from the upper chambers to the lower chambers. And as a result, the heart function is a bit ineffective. It's a very common problem, and it will affect us as we get older. Probably up to 1 in 8 will get atrial fibrillation some point in their life as we get older. Now, what's wrong with atrial fibrillation? The trouble with atrial fibrillation that it can cause a few things. It can, number one, of course, leads to strokes. So for those with the strokes, we want to make sure there's no abnormal rhythm in the heart, contributing to clot formation and strokes. It can lead to heart failure, for example, because heart is not pumping efficiently, and it causes heart failure. It will reduce your quality of life. A lot of patients would have symptoms due to atrial fibrillation. All right, it affects their quality of life, and they may end up going to seek treatment. They feel they age 10 years older when they're in atrial fibrillation. They can't walk as fast, do as much, or carry as a heavy load as before. And of course, it leads to interruption to your lifestyle. Results in unexpected clinic visits, unexpected or unscheduled hospitalization to treat those symptoms. So this is atrial fibrillation. Very common and a little underrated because we always focus on heart attack. So it's one very common condition. And I know some of you may have it. Some of your relatives have it, because I treat these patients in a very common. That's one very common problem. The second one is heart attack or ischemic heart disease. It means coronary artery disease or arteries that are blocked in the heart. Now, this is one scheme, one little video to show what is a heart attack. All right, you can get. So you see this is a heart. The earlier video shows you the electrical system of the heart. This focuses on the arterial system of the heart. The heart pumps 90,000 times a day, so you need good blood flow, isn't it, to nourish the muscles. So this is within the arteries. Arteries are blood vessels that deliver oxygen-rich blood to the heart, so it nourishes it. Usually this is due to what we call the cholesterol build up, narrows the arteries, and it leaks out. When that happens, clots form, and a heart attack occurs. And you will see that the blackened area is an area due to reduced blood flow or no blood flow. When that happens, that part of the heart muscles die. And with that, you have had a heart attack. Some of the symptoms would be chest pain or severe chest pain and discomfort, giving a sense of impending doom. It may go to the neck, to the shoulder for more than 15 minutes. It may bring on sweatiness, nausea, difficulty in breathing, and you have difficulty doing minimal exertion. Normally, you can climb 4 or 5 stories. Suddenly, one flight of stairs trigger all the symptoms in a repeated manner. Likewise, you could run 5 kilometers. Suddenly, 500 meters makes you stop because you have chest pain. You have breathlessness. It goes to your neck, goes to your shoulder. It stops what you are doing. When you stop it, over time, the symptoms are relieved, which means your heart is not able to cope with that degree of exertion. There's coronary artery disease or ischemic heart disease. In severe cases, it leads to heart attack. All right, 2 main common causes. What are they? atrial fibrillation.
fibrillation.
Number 2, coronary artery disease, leading to ischemic heart disease. Who is at risk? All right. Those who smoke. All right. For a lady who smokes, lady who are premenopausal are protected from such diseases due to their female hormones. Now, if they smoke, they remove that protective mechanism of female hormones. That's how harmful smoking is. Those with hypertension or high blood pressure, especially untreated or not well treated, put them at risk. Those with diabetes, and if it's untreated or poorly treated, it increases the risk of all these diseases. Those with high cholesterol, what is optimal is if it's a millimoles, it's 2.6 and below. If it's milligram, it's actually 70 and below. That is optimal. Anything a little above is just desirable. More than 100 milligram, more than 3.3 millimole means not desirable. You should take steps to reduce it. And of course, obesity. In Singapore, a BMI of 23 means overweight. 25 is definitely bordering on obesity. Inactivity, right? There's a lot of good with exercises. If you take high saturated fat, pork belly, the lard, saturated fat, or high trans fat diet. What's trans fat diet? Well, found a lot in pastries because you need the trans fat to be stable so that the fat doesn't dissolve. Nobody likes to eat a oily, stodgy, wet croissant, isn't it? You want it to be crisp. Trans fat is found in a lot of these things. So a high diet of saturated fat and trans fat may lead to increase what we call cholesterol buildup in the arteries, and that can lead to a heart attack. Now, what can we do? Healthy living. All right. It'll be a challenge when you leave this place to the Changi City Point. Healthy living. If you smoke, please quit smoking. Maintain a healthy weight. Exercise regularly, more than 150 minutes per week. Stress management is important because as we face stress of any form, our blood pressure goes up. And that increases the shear pressure or stress to the arteries. Alcohol in moderation, men usually 2 units and less, and women 1 unit and less a day. And if you have hypertension, diabetes, or high cholesterol, it is not the end of the world. It's not a death sentence. Take your medication. Have it controlled. Then that would reduce the risk of all these heart diseases. This is a chart of what is shown to reduce the risk of cholesterol buildup in the arteries, leading to heart attack or strokes. They are the same mechanism. Servings per day, 2 servings per day, vegetables, fresh fruit, whole grains. 1 a day, low glycemic index, cereals, nuts, seeds, yogurt, for example. 4 servings a day, these are your protein sources. No more than 3, white meat, eggs, cheese, milk. And no more than 2, and the occasional are obvious, isn't it? You could see for yourself. Some of my patients said, no, doctor, I eat a char kway teow once in a while. Okay, that's good. But I take a laksa once in a while too. So it turns out that Monday is laksa, Tuesday is char kway teow, third day is pork belly, for example. All once in a while. So you think about how you could moderate it, okay? All right? And lastly, in Singapore, there is a Healthy SG initiative. I'm sure all of you would have received messages on Healthy SG enrollment, isn't it? Please enroll on it because it teaches you, or rather it helps you screen for all these diseases. It is a screen for life, so there's for men, and as well as for women. For men, 50 and above, they would want to screen for chronic diseases and colorectal cancer. These are the 2 most common causes of morbidity for men. And for women, a bit more because apart from chronic diseases, colorectal cancer, they want to screen for cervical cancer and breast cancer as well for women. So sign up, they will help schedule and help screen and help treat as needed. But regardless, all will be screened for chronic diseases. As mentioned, these are the few things that contribute to strokes as well as to heart attacks and heart diseases. Obesity, high blood pressure, high cholesterol, and diabetes. So with that, thank you for your attention.
So, Dr. CK, maybe you can also explain to us, is there a difference between heart attack as well as or cardiac arrest?
A good question too. So we are so well versed about heart attack. As mentioned, the video shows what is a heart attack. A heart attack means that the blood flow to the heart is stopped and the muscles die. That's a heart attack. Cardiac arrest is when the heart stops beating efficiently. So what happens is that the patient or the person, the victim, suddenly turn unconscious. He doesn't breathe properly. All right, sudden. What happens is that the heart goes into a life-threatening abnormal rhythm. We call VF, ventricular fibrillation or tachycardia. You remember the quivering of the upper chambers? It shows the upper chambers are not pumping efficiently. Imagine that happens to the lower chambers. The lower chamber is quivering. So there's no effective blood flow going out of the heart to the rest of the body. That is a cardiac arrest. It's a medical emergency. The heart rhythm must be restored, usually with the delivery of a shock defibrillation within 4 minutes to restore blood flow to the rest of the body, vitally to the brain. If that fails, even if the patient survives, he may end up with severe brain damage. And that's not a very meaningful way to live, isn't it? So cardiac arrest is the heart stops pumping suddenly, effectively suddenly. It is a medical emergency. The most effective way to restore it is with the application of a defibrillator. And I'm sure there's an AED around here somewhere, if you spot. An AED assigned, all at the back. See, our church provides an AED, so you're safe. Your heart's safe. Yeah, so, and what we could do is that if you see that, if you know CPR, you jump on the person, do CPR. Again, AED, apply the AED, it gives you prompt, to shock the heart back to normal rhythm. I'm in Heart Foundation, Singapore Heart Foundation. I work with the committee to install and make AED available throughout Singapore so that Singapore is a heart-safe nation. And we want to work towards a nation of heart savers. And I hope anyone who knows how to do CPR, hey, don't be shy, don't be shy. Okay, all right. Okay, for those whose hands are not up, can I appeal to you to sign up for CPR classes so that you know how to do CPR and extend that help for those with cardiac arrest. Thank you.
Okay. Thanks once again, Dr. CK. Before we proceed on to the next doctor, can we just get MM to show the QR code for question and answer? Okay, so we are going to see a QR code behind the screen. So you can scan the QR code, you can send in your questions, some burning questions that you may have. Okay, please take note that this is not a consultation. Okay, so don't go and key in your symptoms and ask the doctors what you are suffering from. Okay, so this is not a consultation, but it's more for you to ask some questions that you may have as the doctors explain along the way. Okay, so you can do that right now.
Okay, so while you're doing so, let's invite next speaker, Dr. Edward, to share with us about more gut health. Okay, so Dr. Edward.
Thank you. Good morning, everybody. My name is Dr. Edward Cheong. I'm talking about the art of aging, about gut health and how to age gracefully and beautifully. Okay, this is my quick introduction. Senior consultant, upper GI and laparoscopic surgery with 28 years experience. USA fellowship trained. I was the first surgeon, fortunately, to receive this award from my mentor, and also the award from UK, and that's the award from my mentor in 2007. This first 3 slides I'm going to talk to you about is probably the most important thing that you need to remember and to capture, and a lot of you know about this very first one. Prevention is better than cure. Prevention is cheaper than cure, and this is the most important thing from what you need to figure out in Singapore and your healthcare and your own personal wealth. And from the point of view of treating cancer, prevention is easier than cure, which means that the earlier you capture it, the earlier it is for us, and the easier it is for us to help you. Who has heard of colorectal cancer? Quite a number of you, and this is one of the famous actors who passed away with colorectal cancer. Colorectal cancer is the most common cancer in Singapore. It's your number 1 cancer in men, that you need to remember. It's your number 2 cancer in women after breast cancer. So most women, I'll advise them, get your breast mammogram or ultrasound every 2 years, and colorectal cancer is your number 2, so keep up with it. There it goes again. That's your Singapore Cancer Registry report showing that colorectal cancer is your number 1 cancer for men and number 2 for women. So why is this? Well, the clear explanation is our diet and lifestyle, particularly red meat, processed food, alcohol, smoking, which Chee Keung has touched on. It doesn't only affect your heart, it affects your gut. Urbanization and stress. An aging population, we get more cancer as we age. Genetic predisposition, and the fact that we do more colorectal cancer screening like FIT tests and colonoscopy. What's happening in Singapore is that we are a little bit heavier. We have a higher fat diet. We don't really like exercising. Obesity rates are rising. And 60% of us eat more than your daily recommended calorie. 400,000 of us are diabetic. Type 2 diabetes is a risk for colorectal cancer. Smoking has increased by 1/3. Alcohol consumption has trebled. And these are your symptoms. Change in bowel habits, black stools or dark red stools, maroon colored, rectal bleeding, abdominal discomfort. You feel that your bowel doesn't empty completely. You get fullness in your abdomen, fatigue or weight loss. But you got to remember that early cancer have no symptom at all. Polyps are your precursor to colorectal cancer. As you can see over there, on the left side of the screen, when they are small and tiny, they are largely benign. And as they grow over 5 to 10 years, they become a bigger problem and they become the cancer. When they are small, it is easier to treat and it can be treated very easily. And that's part of your understanding of prevention is easier than cure. Colon polyp by size. So as the polyp get bigger, they change and they become more cancerous. And when they are cancer, they are difficult to treat. On the left side, when they are small, to remove the polyp with colonoscopy, it takes barely 1 minute. On the right side, when you have a full-blown big cancer, and if it's operable, you need surgery, which takes 3-4 hours or 5 hours, depending how difficult it is. And then you'll go through another 8 cycles of chemotherapy, which in fact will take you the whole year in total treatment. So from a minute of treatment on the left side with very small polyps to a whole year of total treatment, that's a big, big difference. The key facts are here. Polyps are precursors to colorectal cancer. Most precancerous polyps gives you a 5 to 10 year window of opportunity before they become cancer. And like I said in the first 3 slides, prevention is better than cure. Prevention is easier. And in this aspect from your costing, it's cheaper to remove when the polyp is small. 90%, this is probably what you need to remember here, 90% of your colorectal cancer are preventable through diet, lifestyle changes, and removal of the precancerous polyps. 90%. So it is possible, but we have to play our role, we have to do our part. Colonoscopy is the only gold standard to find and remove the polyps. Unfortunately, more than 70% of us still don't get the recommended colorectal cancer screening. This is your screening age for the average risk group, which means most of us here, asymptomatic, no family history, is about 50 years. In the US, there's been huge discussion to move this to 45 years old. For the high-risk groups, for those who have family history and history of colon polyps in the family, start screening about 10 years before the age of diagnosis of the family member, even if you have no symptom. So 10 years before whoever has had it. Screening test, some of you know about this, some of you never heard of this. This is called a FIT test, and you got to do it every year, annually. Colonoscopy, get it done early, and then repeat it for every 5 to 10 years. That's a colonoscopy. And when we see the polyps, we remove it quickly at the same time. That takes less than a minute. The whole operation and receiving 8 cycles of chemotherapy will take you over a year. The FIT test, well, it's free. Do you know that? Free from the Singapore Cancer Society for those more than 50 years Singaporean and permanent resident. You got to do it annually. Basically, the FIT test looks for occult blood, basically blood which is not obvious to the naked eye. Now, when you do the FIT test, 10% of you will have abnormal FIT tests, and you will need a colonoscopy. 95% of these people will not have colorectal cancer, so don't worry. But 50% of you will have a polyp, so they will need removal. That's your colorectal cancer campaign from the Singapore Cancer Society. You can scan these, get your free kit. And early detection saves lives. Colonoscopy, not the easiest thing to do, not the most difficult either. You need a bowel prep, you need to adjust your medications, and it carries a risk, very small risk, 1 in 10,000 bleeding, perforation, or reaction to sedation. And that's the colonoscopy. And when we see the polyp, we remove it immediately, and that takes less than a minute. Screening saves lives. You got to remember that. That's your survival. And that's the first, on the left side, when the polyps are small, it's easy to remove. You can also do primary and secondary prevention. But when it gets bigger, you get symptoms. So when you're getting symptoms, you have a big problem already. When do you stop screening? Well, this slide clearly shows the age. Anything more on the slide here, anything more than 10%, you need to focus on. So those for the age of 45 up to around the 80s, you have to keep on top of your screening if you are fit enough to have it done. And you can see the peak age group is usually around the 50s to your 70s.
So this means that we should keep on screening, right?
Correct. Yeah. You just got to keep on top of it. Yes. This is your risk factors. There are risk factors that we can't change. They're called the non-modifiable factors, like your age, your gender, race, and family history, and family history in inverted commas. These are your modifiable factors. Modifiable factors are your exercising, your diet, your weight, your lifestyle, smoking, alcohol, and stress. Stress is a big thing here in Singapore. These are your modifiable factors. No exercise, obesity, excess alcohol, smoking, type 2 diabetes, excess red meat. Now, in this gentleman here, your overall risk is 3 times. But your lifetime risk, if you have no family history, is 15%. And in those with family history, you have a risk of 30%. But in this young lady who does exercise and takes NSAIDs, which I don't recommend routinely unless you discuss with your doctors, folate, calcium, fiber, fresh fruits and vegetables, she can, even with a positive family history, she can reduce it to about 5%. And her overall risk is about 0.5%. This is a very significant, simple slide that you can change your destiny. These are your 6 steps to reduce your colorectal cancer. Reduce your red meat. Reduce the processed meat like ham, bacon, sausages, bak kwa. Avoid cooking meat at high temperature like barbecue, char grilling, deep frying. Limit your alcohol intake. 2 drinks for men, 1 for women.
How come men got more?
I'll explain that later. Eat your fruits and vegetables daily. Exercise regularly and maintain a healthy weight. Now that's your treatment, endoscopic resection for colonoscopy for very early cancers. Surgery, we spoke about post-op chemotherapy, which is 8 cycles, chemoradiotherapy for cancer, and immunotherapy. That's all costings. Endoscopic resection is done for very early cancers. Again, it can be done with if it's picked up early, and you may not have symptoms. These are your alcohol-related cancers. As you can see, it affects mainly the gut, breast, liver, but bowel cancer is a big one here. Next, I would like to talk about stomach cancer. This is a cancer that you may have no symptom at the very early stage, but you can get bloating, indigestion, fatigue, vague abdominal pain, heartburn, unexplained weight loss, and loss in appetite. But when you get those symptoms, they are largely a big problem because it's quite late down in the stage. In Asia, we have the highest stomach cancer or gastric cancer incidence and mortality. 75% happens here. And these are your predicted number of cases in the next 2 decades, and you can see that it's going up in Asia. Why? Because we have an increasing aging population. Your gastric cancer incidence again starts here, and remember I said everything above 10% you need to focus on. So again, it's not dissimilar from colorectal cancer. From the age of 45 to around the 80s, you need to focus on the colonoscopy and your gastroscopy. Gastroscopy takes around 5 to 10 minutes more, so we usually do it simultaneously and advise the patients to have both together so that we can just get it out of the way while you're in. So this is when you start and stop screening. These are your main risk factors for gastric cancer. And remember, vegetables and fruits are protective. So have your daily vegetables and fruits. It's easy, it's cheap. You don't need a prescription for this. But you need to get into the habit of doing it. And your habit is also important because you are the leader of the family. So your children will pick up this habit. H. pylori infection, this is your biggest cause of stomach cancer, smoking, family history, a high salt intake, and intestinal metaplasia, and obesity. So having a first-degree relative with stomach cancer is also associated with a high risk of stomach cancer. This bacteria is important to know because it's the biggest cause of stomach cancer. It occurs in 80% of stomach cancer. So when we see it, test for it, eradicate it. Gastric cancer risk factors, which talk about high salt intakes, is a big risk. Pickled foods, processed meats, red meat, food with high fat, smoking. Protective factors, fresh fruit and vegetable, very cheap, very easy. Low salt intake. Gastric cancer screening really improves your survival. Only 2 countries in the whole world does this, Korea and Japan, and that's why the 5-year survival is so much better than ours. Korea starts screening at the age of 40, Japan at the age of 50. That's why Korea is the leader. And in those countries, most of their cancers are picked up early. 63% of their cancer are picked up early. That's the only country that does that screening. So regular health checkups are very important, especially your gastroscopy and colonoscopy. From the age of 50, get investigated earlier if you have any symptom. It is a huge financial burden for us in terms of cancer care. You can change it to your take-home message, test and treat for H. pylori. Eat a healthy diet of fresh fruits and vegetables and low in salt. Physical exercise, all you need is 30 minutes once daily. Again, this is a habit. Get used to the habit. Brisk walking, you don't need to do any running. Okay? And I'm going to go on to the next thing. Sorry, I missed that. Sleep is your new superpower. This is probably one of the best TED Talks you'll ever hear on YouTube. Your best 18 minutes spent. So listen to your body. My colleague here next will talk more about that next. Thank you very much for your time. Yeah.
Okay, thanks,
Thank you.
Dr. Edward. Yeah, please keep the questions coming. We have already some questions already, so at the doctors, we can also check the questions as well to decide on which one to answer. So the next one, we want to talk about mental health. I think mental health is something that's not often talked about in Singapore, and the awareness is getting more with the mental health issues affecting the whole population, starting from young people and even older people as well. So Dr. David would like to share with us the 2 Ds of mental health, the depression as well as dementia. I think dementia is something that both these Ds affect the elderly. Yeah, so yeah, just share with us.
Right, okay, very good morning to everyone. It's a real pleasure to be here, and thank you, Pastor Daniel and team, for inviting me. Right, so just a brief introduction about myself. I'm a psychiatrist. Actually, interestingly, my main area of interest actually is in working with youth, young people. And I resonate greatly with the video that was shown earlier on, right? Because youth, they are our future. But that doesn't mean that we, those of us who are in middle age or who are actually growing even older, right? We are equally important, right? And all of us actually are important, to society. We have much to give, right? And it's important that we stay not just physically, but mentally well, and also, of course, spiritually well, right? That's why we're all here this morning. Right, so in my work at CGH, right, so I see a lot of children, adolescents, but I also see people at all ages, right, in all age part of the lifespan, and do a lot of community work as well in training primary care providers, social service agencies to deliver mental health interventions in the community. Right, and that's something that later on, if you have questions, I'm happy to answer them as well. Right, and another area of interest of mine is actually in talking therapies. Right, many people think that psychiatrists only prescribe medicines and diagnose. Right, actually that's not true. Right, very important part of our mental health actually is not just popping a pill. Right, because there's no simple pill that can just make our problems all go away. Right, in fact, mental health problems are very nuanced. Right, and very complex. Right, and it's important that then we learn the skills in order to cope with this effectively in our life. Right? So I hope to unpack this in a very, very short 15 minutes. Right, okay. So that's the brief outline of today's talk. Right? Okay, so first of all, right, Singapore, as we all know, is a rapidly aging country. Right? In fact, statistics show that by the year 2030, right, 1 in 4 Singaporeans will be aged above 65, right? And that's the age in which we define the elderly. Right, and so you can see that actually more and more, it's an aging population, right? More and more elderly people in our population, and the proportion of people who are younger, right, less than 15 years old, are getting less and less, right? And understandably so then, our government is very concerned, right, that we all age healthily. Right, and also we need to protect the health of the younger people who are going to take care of us when we all grow old as well. Right, so as we grow old, what happens to us? So firstly, there are physical changes, right? And I think we can all identify that, right? Edward and Chee Kiong have already spoken about this, right? We have problems with our eyesight, our heart, right? Our gut, so on and so forth, right? And we grow more and more physically frail, right? And we need to take the necessary steps in order to keep ourselves physically healthy. But we also have emotional changes as we grow older, right? And some of these emotional changes, right, may be due to certain life adjustments, right? As we grow older, not only do we have to grapple with the fact that our bodies are slowly, right, getting weaker and more frail, right, and the onset of various kind of chronic diseases as well, or even things like cancer, we also see that happening to our friends and our loved ones, right? And some of us with elderly parents, right, they also start to develop health problems, and we start to lose them, right? And so we deal with things like grief as well, bereavement. Right, and not only that, right, we also start to see our own physical health problems mount, and as we retire, right, perhaps some of us may also have, we may find a lot of meaning and purpose in the work that we do, right, and I hope most of us do so, right, and as we retire at different stages as change in our life, right, we may have to grapple with other certain losses of our roles as well, right, and of course this takes an emotional toll on us. And the other thing is, of course, loneliness as well, right? So that's something that I'll touch on in a moment. Lastly, right, cognitively, right, you may also notice certain changes as we grow older, right? Some of us, we may find that, hey, I find it's harder to learn something new, right? Or we find that, there are little lapses in our memory here and there, right? But not to worry, that doesn't mean that you're dementing, right? Okay, so yes, the 2 big Ds, right? These are amongst the most common mental health problems that we encounter in old age, right? So I'm going to unpack that in a bit more, right? So depression, firstly, right? Okay, so how common is depression, right? Okay, so if we look at this, like just borrowing this slide from the Institute of Mental Health, right? This is based on the National Mental Health Study, right? And it showed actually that 1 in 17 people in Singapore will have episode of clinical depression in their lifetime. Right? That doesn't mean that your normal feelings of sadness. Right? I'll touch on that in a moment as well. Okay, and you can see actually alcohol abuse actually comes in second, right? So, and earlier on, I think the other speakers have already talked about the importance of drinking in moderation. Right? Of course, obsessive compulsive disorder comes in third. Singapore is said to be the OCD capital of the world, right? We want to be the best in everything, right? And OCD, we are also number one. Okay. Yeah. All right. Okay, so focusing in on depression in adults, right? Okay, I could give a whole 1 hour talk on this, but just key points, right? So what are some common life stressors that may predispose us to developing depression in old age? So I talked about earlier on, stopping work, right? Loss of role, right? Of course, it's inflation, right? Yeah, post-COVID inflation is been a hot button issue around the world. So financial worries, right? Stress, mounting health problems, and of course, death of a partner or people close to us, right? And it's been found worldwide, right? That this some of worldwide statistics that 1 in 5 older people living in the community can be affected by clinical depression. Right, and in the nursing homes, right, in people who are institutionalized, that figure doubles, right? Obviously, right, because it's really you're quite lonely there. You're separated from your family, right? And most of these people have chronic health problems that require them to live in a nursing home, right? And 1 in 4 people suffering from dementia, right? So dementia and depression go hand in hand. Right, will have clinical depression at some stage of their illness. And if you look at it the other way around, people with depression also have double the risk of developing dementia. Right? And the reasons for such are actually quite complex. Now, okay, this is something interesting that I thought is important for us to understand. Right? Not sure if you've seen something like this before, right? But this is developed by a German-American psychologist by the name of Erik Erikson. Erikson came up with this theory of the stages of psychosocial development, right? And I think we are all familiar with all this, right? Different stages of life, right? From infancy, right, to early childhood, all the way to middle adulthood and old age, right? And what Erikson posited was that at each stage of life, we need to navigate certain developmental tasks, right? And the successful navigation of these tasks allows us to develop psychological strengths, right, that enable us to move on to the next stage of life, right, with a sense of competence, right, that, hey, I can deal with the various challenges that come along in our life. But of course, not all of us are able to do so successfully, and failure to do so then brings about certain stresses, right, that would then actually make it difficult for us to cope in the next stage of life. Right, so if we home in on middle adulthood and maturity or old age, right, you'll see that in middle adulthood, right, people are usually at the prime of their life, right? They are in the peak of their careers, they have children to take care of, right? And it's important for them to stay generative, right? That they are actually trying to, focus on providing for their family, grow in their career, so on and so forth. Right? But of course, if we are unable to do so, right, we may feel that, life is stagnating, right, and that again can predispose one to developing different problems, right, such as depression and anxiety. And then moving on to old age, right, when we retire, right, we probably have grandchildren by that time, right, we start to look back at our life, right, and take stock of what we have done, right, and say, have I done well, right, what can I be proud of, what have I accomplished, right, what am I thankful for? Right? And if we look back and there are a lot of regrets, right, there may be a sense of guilt that starts to overwhelm us. Right? And then again, that's something very common that I see in people in the retirement age, right, when they come and see us in the clinic, right, that they have a lot of regrets, right, and losses, right, and things to grapple with, right, that maybe children are not doing well, or they have certain health problems, right, and past hurts that they're trying to grapple with. Okay, so very quickly, right, I think we are probably all very familiar with this, right? A lot of awareness now, right? But what are the symptoms of depression? So very broadly, we can divide them into mood, right? Emotional symptoms, there are physical symptoms, right? Cognitive symptoms, and social and behavioral symptoms. So mood symptoms, obviously, right? Pervasive low mood, irritability, anxiety as well, right? Okay, so they go hand in hand. Anxiety is like the close cousin of depression. Right, physical changes, right, like sleep disturbances, changes in your appetite, lethargy, right, decreased motivation or energy, decreased sexual interest and drive. Cognitive symptoms, how we think about ourselves, the world, and other people, right, like a lot of negative thoughts like guilt, self-blame, worthlessness, hopelessness. Interestingly, right, a lot of people don't recognize this, that slower thinking as well, right, indecision, memory lapses as well could also be signs of depression that sometimes people mistake for dementia. And of course, in severe cases where people think actually that things are so hopeless, they may end up having suicidal thoughts. Right? Okay, and lastly, right, the social or behavioral symptoms, right, where you start to feel very dissatisfied, unhappy with relationships, right, feeling lonely and isolated, and being more and more withdrawn. Right now, importantly, right, we all would probably have had some of these symptoms, right, in our life, right? But don't be alarmed, okay? That doesn't mean that you are clinically depressed, right? So that's why I just like to share this with you, okay? So now we all, this is what we call, it's just a continuum, right, okay? And sometimes in our life, we all will encounter different kinds of stresses, right? Whether it's health stresses, financial stresses, interpersonal stresses, right? And that will then affect the way we think, the way we feel, the way we behave, right? And those are some of the things that we covered, right? The broad symptoms, classification or categories of symptoms of depression. And that will naturally cause us to feel distress, right? So hopefully, most of us are what we call in the green zone, where, you know, this don't affect us so much, right? It's like the green light. You can still go on with life. But sometimes when these stresses start to mount, it's like the amber light, right? Where we start to slow down, it starts to affect us, right? It starts to make us worry a bit. Right? And when this is persistent, it lasts for more than just 2 weeks, for example, in the case of depression, right? It's pervasive. It affects different aspects of our life, not just our work life, but our family life, our social life, right? That's when we start to worry, right? So the 2 P's and 2 D's, right? It's causing us undue distress, right? And lastly, it's causing us dysfunction, right? It's starting to affect our relationships. It's starting to affect our ability to perform in our work or our studies, right? You know, that's when it's what we call being unwell, right? So hopefully, most of us are all on the other end of the spectrum, right? Healthy, but we may oscillate, right, between the green zone, the amber zone, and sometimes the red zone, right? And of course, the red zone is when you need to actually think about going to see your doctor, right, your friendly neighborhood GP or the polyclinic, to get yourself checked, screened, right? And if the doctor is concerned that you may have depression, they'll refer you on to see a different mental health professional if necessary. GPs nowadays, I like to say that many of them are also equipped to diagnose and treat milder forms of depression and other mental health problems. All right, moving on to dementia then, right? So what is normal age-related memory impairment? And most of us, right, would have strong memories as we age, and we retain skills and knowledge that we've learned throughout our lives, right? We don't forget how to drive, we don't forget how to read, right? Okay, time's almost up. Like but age-related memory impairment is slightly different. Okay, right? So this is normal. Okay, that it doesn't disrupt our day-to-day life, right? It doesn't affect our ability to perform tasks, right, or to learn new things and all that. But if it's starting to affect our activities of daily living, or what we call instrumental activities of daily living, right? We are, not able to perhaps go to the bank to withdraw money, right? We are not able to go to the supermarket to buy our groceries, but we're having problems with all that. We're losing our way. Okay, this is when you need to worry. Okay, so what is dementia? Very quickly at a glance, can take a photo of this, right? It's impairment in our brain functioning that such that one's day-to-day living is compromised, right? So that's what I mentioned earlier on. So these are some of the common symptoms that people with dementia may have, right? They may have difficulty, like for example, expressing themselves, finding the right words to say, right? They may be more and more forgetful. They can't remember what they ate for breakfast, right? And in more severe cases, they may not even be able to recognize their own family members, right? My own elderly grandmother in her mid-90s, right? Unfortunately, she can't recognize me anymore as well, right? And I think this is something that as we grow older, right? By the time we are age 85, 1 in 2 of us will suffer from dementia. Okay, and so statistics show that 1 in 10 at the age of 60, right? Just this week in the Straits Times, you may have read an article that showed that the prevalence has come down very slightly to 8.8% from 10%, right? But as we grow older, age is the biggest risk factor for dementia, actually. Okay, so these are just at a glance the different types of dementia. Alzheimer's, the dementia is the most common, followed by vascular dementia. So just now, earlier on, right, talk about strokes and heart attack, right? That's closely associated with vascular dementia, right? Where you have multiple mini strokes accumulating over time in your brain that causes damage to the brain structures and therefore it can cause problems with your memory and other important brain functions. Right, and you can see here, right, this is what we call a clock drawing test, right? So one of the clinical tests that we do in the clinic, we ask the patient to draw a clock, an analog clock, right, not your Apple Watch or anything, right? And you can see people in an advanced stage of dementia, right? MCI is mild cognitive impairment or early stage, right? You can see that people with advanced stages of illness, they have problems doing that, right? Okay, so different parts of the brain are responsible for different brain functions, right? And so, of course, if there's a degeneration in certain parts of the brain over others, then you have more impairment in those brain functions. Right, so just at a glance, very quickly, right, some of these online resources that you can actually easily Google, right, very, very informative websites, the Agency for Integrated Care, Dementia Singapore, right, Caregivers Alliance is a very, very a good organization that for people, many of us who have loved ones who suffer from dementia or friends or even mental health struggles, right? They provide caregiver training, right? My own church, I worship at the Adam Road Presbyterian Church. We actually also in a partnership with them. We actually currently, they are running a course for some of our church members and guests, right? Okay, so very quickly, right? I know I've run out of time, right? But this will hopefully address some of the Q&A as well. How can we reduce this risk? Okay, so I think this is what we call the wellness wheel. Like, so you can take a photo as well. But essentially, right, wellness is not just limited to physical and emotional wellness. There's also spiritual wellness, social wellness. So staying active, right, cognitively, physically, spiritually active, these are all important for overall physical and mental well-being. Right, and okay, yes. Right, so again, this was all talked about earlier on, healthy living, right, don't smoke, reduce your alcohol intake, stay cognitively active, socially active, exercise, yeah, right, and you can see, right, around the island, okay, our government is working with various social service agencies to develop active aging centers, and I will encourage you to actually go and check some of these out. I've personally visited some of these in the course of my work as well, because we work with them to equip them to screen, right, and to conduct interventions as well for people in the community. And I'm really impressed, I can tell you, with the kind of facilities that they have, right. You can see carpentry studios, they have, like go there, chill, have coffee with friends and things like that, right. And it is really wonderful. Okay. Yep. So I think that brings me to the end of my talk. Yeah.
Okay.
Thank you.
Thanks, Dr. David, for sharing. We'll go on to the segment on Q&A. So we have a lot of questions, but I don't think we have time to answer every single one of them. So maybe the doctors, we can take a top one or two that you want to answer.
How much time? 2 or 3 minutes?
Okay.
You
can look at the ones that is
okay,
in the phone. Yeah.
I got it.
You can choose.
Okay, so let me just answer a few quickly, right? What does an extra heartbeat mean? Sometimes the heart pumps a bit earlier or later because the electrical the signals are a little disturbed or a little abnormal. It's a very common symptom, but if it's not related to other features like fainting spells or very rapid heart rate, usually that's more tolerable and usually does not affect the quality of life nor the lifespan. But if you do have, please have it assessed so that they could tailor the treatment for you. Me one more, is lard better than vegetable oils? Say, wow, what pointed questions. The chefs over here will say, of course lard is better, right? How to have bak chor mee without lard? Isn't it? But lard is saturated fat. It will increase the bad cholesterol. And I'm sure you all understand the bell curve, isn't it? Right? You will see 90-year-old people smoking, taking lard, and they're in the prime of health. And they are blessed with good genes, who take care of all these risk factors. That's on the right extreme. Maybe 1 out of 10,000, 1 out of 100,000. But most of us is in the middle. All right? So if you have cholesterol is not optimal, then you have to take steps to manage your cholesterol, including dietary and medication. All right, so I'll leave it to you. You want the authentic taste of bak chor mee and fried Hokkien mee with lard, or you rather prioritize managing your cholesterol? One more last one. What's calcium score? Well, calcium score, put it away, is as we age, calcium will be formed in our body. You will get calcium everywhere, in the brain, in your organs, in the arteries. All right. So likewise, in the heart, the arteries to the heart. So a calcium score is a simple way to look at how much calcium is there in the arteries to the heart. Again, it's a bell curve, right? For those from the 50s, the amount of calcium is this much, very low. Those in the 80s, the calcium is a little higher because it's aged, isn't it? So if we have an abnormally high calcium score for our age, it suggests that, hey, there are abnormal arteries, abnormal or thickened arteries. Just a sign. And that merits more investigation. Thank you.
Yep, thanks, Dr. Chee Kiong. Dr. Edward, I think there are a number of questions on probiotics, prebiotics.
There's a lot of
colon
I
cancer
actually have a
screening.
few slides. Can I show them, the few slides, or we have no time for that?
Maybe you can quickly.
Okay. Prebiotics, probiotics. Okay. Prebiotics, probiotics, and postbiotics. Most of you would probably heard of pre and pro, but not the post. So prebiotics is what you eat, your dietary fibers and etc., which you need to feed the probiotics, which is the good bacteria. And by doing the pre and the pro correct, you will automatically get everything correct. So the postbiotic is the metabolites produced from the good bacteria that enhances your gut health, your mental health, your physical well-being, etc., etc. So it's very easy to understand it. Eat the healthy, high dietary fiber stuff, feed the good bacteria. But the thing is, when you go to the toilet every day, you poop, you also lose your good bacteria. So you need to replace it daily. That's the long and short of it. Is it advisable to prevent or lower the risk of cancer? Yes, there are some evidence. It's not totally an easy thing to do, randomized control trial on these things, because it's such a big conflict of a lot of other things out there. So it's not just because I take probiotics, I'm not going to have cancer. That's number one of it. Is FIT test accurate, or should a colonoscopy be done? FIT test is not as accurate as colonoscopy. Number one, FIT test is only about 60% accurate, but you have to do it every year. Colonoscopy is, of course, 95% accurate, and the great thing is when you do it, you remove the polyp straight away, so it's one-off. Is colonoscopy CPF MediSafe deductible? Yes. What type of health screening is recommended for seniors to provide a comprehensive annual review? It's not an easy question to ask because it depends on cost. And as I mentioned earlier in my slides, prevention is better than cure. Prevention is cheaper than cure. And prevention is easier than cure. Now, a comprehensive annual review, the thing you have to understand is for a lot of Asians who are slimmer and thinner, ultrasound is a good test, but it doesn't look inside the stomach or into the colon easily. It will not pick up a polyp or a precancerous polyp. Having your blood tests, apart from having your PSA done, the cancer tumor markers, they are a waste of time. They cost you a lot of money every year. Put that money, save it aside, and go for colonoscopy and gastroscopy. That's a wiser way of doing it. Because the tumor markers are only about 5% accurate, for by definition 95% inaccurate. So they give you a false sense of security. The only one that's more accurate is PSA for the man. It's about 60 to 70% accurate, so it's quite reasonably good in the scientific sense of the word. There's one on H. pylori. Was it? Let me see that one.
Yeah, does it mean that you have a
What is
higher
that?
risk?
Okay, H. pylori. Once you find it, you treat it, eradicate it, but then 3 months later you come back, you need to have a check test called the urea breath test to check that you have eradicated it, and that's the key. Can you pick it up again later on? Yes, you can, but it's very, very low risk. Less than 10% of them will pick it up again. So the key is that H. pylori is responsible for 80% of stomach ulcers and stomach cancers. So find it, treat it early, eradicate it, forget about it. Over to you, David.
Okay, right. I think there's some questions about depression, right? Will someone who is depressed be able to bring themselves to see a doctor? I think in most cases, yes, right? If not, we wouldn't have business in the clinic, in the hospital, right? So there are many, many people who come forward to get treated for depression. But of course, yes, in certain cases, in severe depression, you may find that friends or loved ones may have difficulty, right, by the very nature of their condition in itself, right, to get themselves out of bed, to go to see a doctor. And sometimes, of course, I think we are all very well aware as well that stigma is still very much present in our society. I think we are very thankful that in the past couple of years, our government has really been focusing, right, doubling down on its efforts to destigmatize mental health problems. And so I think we are encouraged that more and more people are actually coming forward, right, at all ages, right, for help when they are distressed. Right, so remember earlier on, right, I told you that the 2 Ds and the 2 Ps, right, not everyone needs to go and see a doctor, but if you're not sure, go to your polyclinic, go to your neighborhood GP, right, whom you're familiar with, right, talk to them, right, and if they screen and they think that you may be clinically depressed or anxiety or other problems, right, they will refer you to the relevant resources, many of which are in the community. All right, there's another question on, was it about dementia, right? Is it preventable? I think we've covered that earlier on. There was another one on if a family member has dementia, does that put one at higher risk? Certainly it does, right? But again, that doesn't mean that necessarily you will develop dementia, right? The chances that you don't develop dementia are much more than the chances that you will actually develop dementia. What it means, actually, the statistics actually mean is that compared to someone, right, without a family member with dementia, one who has a family member with dementia would be at higher risk. So I think if we take the necessary steps, right, to keep ourselves physically healthy, emotionally healthy, cognitively engaged, right, socially engaged, all these things actually can can really help to bring down our risk of dementia. However, right, as I mentioned earlier on, age is something that we can't change, right? We all grow old, right, and one day, right, we will all pass away and go and be with the Lord. Right, so as we grow older, naturally our brain degenerates, right? That's how we are all created. And so yes, age is something that we can't turn back, right? But hopefully we can age well and age healthily and enjoy more years of healthy life.
Okay, so friends, let's put our hands together to thank you, the doctors, for their sharing. Dr. CK, Dr. Edward, and Dr. David for their sharing. You know, I've seen the questions. There are actually a lot of questions that you guys put forward. So this shows that health is really a concern, okay? But due to the limitation of time, we are not able to address every single question. But these are our experts, okay? Other than Dr. David, who is from another church, Dr. CK and Dr. Edward, they are from our church. So if you have any issues, do make an appointment to see them, okay? If you can have a chat with them at the end of the service or things like that, okay? And then you can, if there are serious issues that you need to talk about, you can make an appointment to see them as well. I think they will be very glad to see all of us, okay? Yep. So once again, let's thank our panel of doctors for sharing. You know, friends, no matter how healthy we can be, there is no guarantee. We can't prevent ourselves from falling sick. Okay, but there are things that we can do. We can take ownership of our life to reduce some risk factors from getting into some of these sicknesses and diseases. So I'm going to quickly summarize what the doctors have shared earlier on reducing our risk factors. So first of all is to eat right. So we're going to eat a balanced diet, cut down on red meat, cut down on sugar, salt, cut down on the alcohol, don't smoke, and cut down on saturated fat. And second of all, we have to manage our stress. Manage our stress. Okay? And being in the community actually helps. Okay, so managing our stress. And third is to have regular exercise. So don't just do one form of exercise. At our age, right, we need a mixture of exercises. We need a mixture of cardio, strength, as well as flexibility exercises. That means do your stretching as well. Don't neglect that. And fourthly, we need to go for our regular health screening. If you don't know where to go for health screening, I want to introduce Joseph. Joseph, will you just stand? Joseph runs a clinic that does health screening. He's not a doctor, but he runs a clinic that does a health screening. He provides very good services. Okay, so if you don't know where to go for health screening, we can talk to him after the service. Okay, so thank you, Joseph. And then we have to remain active in a community. That's very important as well. So when you do all this, you reduce the risk factors of the various cancers, of heart disease, as well as your mental health. No, while it is important for us to take care of our health, because we also want to be a good steward of our body. Our body is a temple of the Holy Spirit, right? So we want to be good stewards of our body. But we mustn't become so overly obsessed with our health that it becomes an idol in our life. You know, every day talk about health, this cannot eat, that cannot eat, and then life will be very miserable. Okay, so we cannot come to that stage whereby you're so overly obsessed with our health until it becomes an idol in our life. You know, Irish playwright as well as Nobel Prize winner George Bernard Shaw, he shares this, that the statistics on death are quite impressive. And 1 out of 1 people die. Isn't it impressive? Yeah, so what this means that in a room like this, in the next 40 to 50 years, all of us will be dead. Or most of us will be dead because there are some younger people. I know there's one young one around. So most of us will be dead in the next 40 to 50 years' time. You know, the truth is our bodies are wasting away. Our bodies are actually deteriorating every single day. Whether we can live up to 80 years, 90 years, or even 100 years, one day we are going to face death. That's a fact. That's why 1 out of 1 people die. It's a fact. Okay? So even if we take care of our health, there is no guarantee that we will live to a ripe old age. And the sudden passing of Joseph Chen last year is a good reminder for us. You know, I know Joseph personally. He was someone who was very fit and healthy. Okay? When you look at his body, he's trim, he's fit. The fat percentage is very low. He took good care of his body. He exercised regularly. He ate healthily. But despite all this, his life was cut short by that tragic accident in Turkey. You know, while we cannot make plans for how we enter into this world, all of us should actually make plans for how we want to depart from this world to enter into eternity. And that involves some questions that we need to think about. Like, how can we make sense of this short and uncertain life that we are living? Or what makes our life worthwhile and what makes our life significant? And the brevity and the uncertainty of life is not something that's new in the Bible. The Bible talks about the brevity and the uncertainty of life. And the Bible also gives us instructions on how we should make sense of this life and how we should live out this life. So today, I'm going to wrap up by sharing 2 perspectives about living out our uncertain lives here on earth from this psalm in the Bible, Psalm 90. Okay, so the first perspective that I'd like to share about our lives is that our lives are brief in comparison to eternity. Our lives are brief in comparison to eternity. And this is from Psalm 90. Psalm 90, verse 3 to verse 6, it says this: You turn people back to dust, saying, Return to dust, you mortals. And verse 4, 1,000 years in your sight are like a day that has just gone by, or like a watch in the night. Yet you sweep people away in the sleep of death. They are like the new grass of the morning. They spring up in new, but by evening it is dry and withered. So Moses here is the author of this Psalm 90. In fact, Moses only wrote one psalm, and this is Psalm 90. So in these 4 verses here, Moses described to us the condition of human life, that our human life is limited and our human life is uncertain. In verse 3 here, Moses talked about how our life is actually very brief. It says here, you turn people back to dust. So here Moses is referring to Genesis chapter 3, whereby one of the consequences of the fall is that mankind will return back to dust, where we were all created from. And then in verse 4, Moses told us that even if we were to live to a lifespan of 1,000 years, this is still a very short time compared to God's eternity. He talks about a watch in the night. A watch in the night refers to 4 hours. Okay, so 4 hours compared to eternity is very short. And in the Bible, we know that the oldest man, who knows the oldest man ever recorded in the Bible? Who is this guy? Methuselah, that's right. Methuselah lived up to an age of 969 years old. So Moses is here telling us that even if we were to live like Methuselah, close to 1,000 years old, we are still short. Okay, our lifespan is still short compared to God's eternity, because God is an eternal God. And then in verse 4 here, Moses talked about the uncertainty of life, whereby people can just be swept away by death. And by this, he's referring to how people were swept away during the flood in Noah's time. That they are going about doing the normal things, and then the flood suddenly came and swept them away. So this talks about the uncertainty of life. And then in the rest of verse 5 and verse 6, Moses uses the analogy of grass to talk about the brevity of human life. That just like a grass that springs up in the morning, by evening time, you're all withered. So this shows us that human life, our lives are limited. Our lives are brief in comparison to God's eternity. So that's the first perspective. And the second perspective about our lives is that our lives are filled with trouble and sorrow. Our lives are filled with trouble and sorrow. And Moses went on in Psalm 90, verse 7 to verse 11, to explain to us why our lives here on earth are brief and uncertain. Verse 7 says, "We are consumed by your anger and terrified by your indignation." And verse 8, "You have set our iniquities before you, our secret sins in the light of your presence." And verse 9 says, "All our days pass away under your wrath. We finish our years with a mourn." So man's life are uncertain and brief because we are all sinners under the judgment of God. We are all sinners who are living under the righteous judgment of God. And we know that death itself is a result of God's judgment on sin. The Bible tells us that the wages of sin is death. And God is fully aware. God is fully aware of all our sins. That's why the shortness of our life basically is a proof of that God is aware of our sins, even our secret sins. Sins that we don't recognize, or sins that we try to justify away. All these secret sins are all evident before an all-knowing and a righteous God. And the thing is, sin not only affected all human beings, but sin also affected all of God's creation. And because of sin, that's why we have things like diseases, we have things like natural calamities in this world. Romans chapter 8, verse 20 to verse 22 tells us, "For the creation was subjected to futility, not willingly, but because of God who subjected it, in hope that the creation itself will also be set free from the bondage of decay into the glorious freedom of God's children. For we know that the whole creation groans and suffers together until now." So the whole creation, including everything on this earth, is tainted, is corrupted by sin. And that's why our bodies are wasting away every single day. That's why we see accidents. That's why we have natural disasters. That's why we have diseases that takes away precious lives. Even though we know that Jesus has redeemed us from our sins when we put our trust in Him, but the truth is we are still living in an imperfect world tainted by sin. And because of that, we will face pain and suffering. Because of that, our lives will have sorrow and our lives will have trouble. In verse 10, Moses describes, "Our days may come to 70 years or 80 if our strength endures. Yet the best of them are but trouble and sorrow, for they quickly pass and we fly away." What he means is that some of us, we may live above our average lifespan of this nation. Some of us, we may live below the average lifespan. Whether we live above or below the average lifespan, the truth is, even the best of our days, even the best of our years are filled with trouble and sorrow. Why? Because we are living in a sinful and a broken world. And that's why. So since our lives are short, uncertain, filled with trouble and sorrow, how do we make sense of our life? How should we live out our lives? There can be two ways to live out our lives. The first way is to adopt this attitude of to eat, to drink, and be merry, for tomorrow we die. Sounds good, right? Eat, drink, and be merry. You only live once, YOLO, right? You only live once. Let's eat, let's drink all the alcohol, let's eat all the bak kwa, all the steak we want, and be merry, for tomorrow we die. What's the point? But this view is flawed. This view is flawed because the Bible tells us that death is not everything. It's not the end of everything in life. That there is eternity. That one day, everyone, all the dead will be resurrected, and everyone will have to stand before God to give an account to God on how we are to live out our lives. That's why our death on earth here is not the end of everything. All of us will have to give an account to God for how we live out our life. So then, how should we make sense of this short and limited life? Moses tells us in Psalm 90, verse 12, that we are to live our life wisely in light of eternity. We are to live our life wisely in light of eternity. Psalm 90, verse 12, Moses is sharing with us here that our fleeting and passing lives have value and has meaning if we live wisely before God. He says, teach us to number our days, that we may gain a heart of wisdom. So Moses here is asking God to teach us to number our days so that we may gain a heart of wisdom. Before that, please, the slide. So by asking God to teach us, it means that this is something that we have to learn, right? Otherwise, there's no need to teach us. It's not something that happens automatically. We are asking God to teach us. And to teach us what? Teach us to number our days. And to number our days means that we are to recognize that our lives here on earth are limited, our lives here on earth are futile and are uncertain, and how we should make sense out of this life. What this means is we have to acknowledge that there is a dark side of life. There's a dark side of life, and we should learn to embrace pain and suffering in light of eternity. That while we may suffer for a short while, we have the hope that Jesus is going to come back one day and going to restore everything right, and that all of us is going to spend our eternity forever and ever in the presence of Jesus. Can someone say amen? 2 Corinthians chapter 4, verse 17 tells us, for our light and momentary troubles, it's light and momentary in comparison to eternity, are achieving for us an eternal glory that far outweighs them all. It can be no comparison to the eternal glory that God has prepared for us. And the second part of verse 12 tells us that we should number our days. We should number our days so that we are able to live our life wisely before God, so that we can gain a heart of wisdom. The Bible tells us in Proverbs that the fear of the Lord begins with wisdom. No, sorry, the other way around. That the beginning of wisdom starts with the fear of the Lord. So the starting point is always a relationship with God. That in order for us to live our life wisely, we need to have a relationship with God. Because when we have the right relationship with God, we start to see things in the right perspective. That we start to recognize that our lives here are so limited, our short and uncertain compared to God's eternity. We start to recognize that our man's sinfulness in contrast to God's holiness and righteousness. And as we begin to fear God, as we begin to live our life righteously, then God gives us the wisdom to discern life as it is, so that we are able to make the most out of our limited and uncertain lives. At the end of the day, only God's kingdom will last forever. So let's not waste our life chasing after worldly accolades, accumulating material things that we cannot bring along with us, that will one day rot. But let's really invest our limited lives, our uncertain lives, in building God's eternal kingdom. You know, all of us, God has given to us spiritual gifts. God has given to us talents. And over the years, we have accumulated wisdom. We've accumulated experiences. We have accumulated skills. And we can use all this to serve God while we still can. You know, in church, there are various ministry needs whereby seniors can serve in and thrive in. And some of this includes serving in ushering. Some of them includes in hospitality ministry, Connect Corners, in security, Hope Connectors, marriage mentoring, dialect Mandarin services. You can involve in that. You can be an intercessor in church. You can serve in Hope Center by serving the community as well. And you can be involved in missions. So if you think that you can contribute in any of these areas, I want to encourage you to talk to your life group leaders on how you can get involved in doing this. You know, last week, Pastor Chua shared with us that our seniors years is the best season for us to win souls for Christ. And Proverbs 11:30 tells us that he who wins souls is wise. So we need to live our life wisely, making an impact for eternity. By the year 2030, 1 in 4 Singaporeans will be above the age of 65 years old. And many of them still do not know Jesus, because the population of Christianity in Singapore is only 20%. So many of them would not have known Jesus. And the harvest is truly, truly plentiful. Other than reaching the young, God is going to use us to reach people of our age group, the seniors in Singapore. So let's really invest our life into winning souls, winning all these precious souls for eternity. You know, as I wrap up today's message, you know, I don't want all of us to go back thinking that, I need to be healthy, I need to be healthy. You know, while it's important to take care of our physical and our mental health, health is not everything there is to life. Because there is eternity. Because there is eternity. Our life here on earth is brief, is uncertain. Nobody knows what's going to happen tomorrow. But all of us, we have a choice. We have a choice to live our life fruitfully and meaningfully for eternity. The art of aging, you know, it's not really taking care of our health. While that is important, the art of aging is how we live our limited lives meaningfully and wisely in light of eternity. Let me say it again. The art of aging, how we can age beautifully and gracefully, is in living our limited lives meaningfully and wisely in light of eternity. And I just want to end by sharing this famous quote from British missionary C.T. Studd. He says, "Only one life will soon be past. Only what's done for Christ will last."